سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Ilm TV. We're just continuing the process of the health and lifestyle program. I'm Dr. Hussein. I work with Pisha Hospital as a pediatrician. Welcome. This is just a series of talks we're going to give you on child growth, child health, child development. We discussed one segment where we had just the growth of a normal child. We had a second segment where we looked at the vaccination schedules, some of the problems faced with vaccinations, and what should be done when we're giving the different types of vaccines and how to overcome the problems faced by them. This session is going to discuss breastfeeding, some of the problems associated with breastfeeding, how to store breast milk, and some of the benefits and problems associated when a mother is breastfeeding her child and watching the child actually feed. So I'll start off with one of the things I'd like to discuss is the benefits of breastfeeding. We often underestimate the benefits of breastfeeding, thinking that we should start a child as early as possible, and some of the substitutes like the cow milk formulas. We start children on other feeds such as porridge by as young as 2 weeks. Interestingly enough, there's been a lot of evidence going back across centuries suggesting that nothing comes close to exclusive breastfeeding for at least the first 5 to 6 months of life, preferably 6 months. Some of the benefits of breastfeeding actually because one, breast milk has the right amount of energy, the right amount of protein, and the right amount of vitamins and minerals which a baby requires for their growth. It's available at exactly the right mixture, such that when we try and create an artificial substitute, we cannot match the exact requirements, so digestion becomes harder when we give all the other substitutes. Again, the first amount of breast milk that's released when a baby is born within the first 1 to 2 hours after a baby is born by the mother, what we call the colostrum. It's a small volume, probably less than 10 mLs of milk. It's very concentrated in all the different protection for the whole system of the baby when the baby takes it in. We've now realized that small amount of milk, what it does is when the baby suckles and feeds on that, it goes down protecting the mouth, it goes down protecting the intestines, and forms a coating which acts as a protection against disease. It acts as a protection against some of it actually allows the baby to digest a lot of the food products after that, and protects them against diarrhea, protects them against a lot of infections. Not to mention that first bond between the mother and the child improves the mother's milk flow subsequent to that. So it makes it easier for the mother to produce more breast milk. One of the other things we have realized about breast milk is it's nature's antibacterial, antiviral, antifungal, all those properties it contains, which means antibiotics are not that necessary for baby at that point in time, simply because the breast milk is providing a lot of those substitutes. Then when we look at the comfort of the baby and the growth of the baby, when the baby breastfeeds, that contact between the mother and the child is a bond that we found that every time the baby feeds, it's soothing for the baby, that's one. So if the baby was scared for any reason, the heart rate comes down. That bond between the mother and the child improves the baby's mental growth, psychological growth, and that sucking that the baby does when the baby is put on the breast improves the mother's blood flow of milk. At the same time, it strengthens the baby's lungs, it strengthens the baby's mouth, so improving the baby's breathing, overall making the baby grow a lot healthier. There's a whole chapter on that devoted to this by the World Health Organization. In case anyone wants more details, if you just get onto the World Health Organization website on the internet, they have about 10 to 15 benefits of breastfeeding, and it's a whole almost 2 to 3 hours of reading if you're interested in that. some of the things we ask is, why should a baby breastfeed immediately within the first 1 hour after birth? The benefits both to the mother and to the child. So to the mother, the benefits are, when the baby starts to breastfeed, the process of breastfeeding releases a very specific set of hormones which reduce the duration the mother is going to bleed after delivering the baby. And then when the baby comes out, when the baby is attached to the womb, there's the placenta which has all the blood vessels. It aids in the removal of that. So in other words, the mother's birth process is facilitated by the baby breastfeeding. It's also painkiller for the mother when the baby breastfeeds. So a lot of the times the mother may not need a lot of medicines simply because the process of the baby breastfeeding has made it easier for the baby to come out. The other thing is that initial feeding that the baby starts, one, improves the mother's milk flow, allows the baby to get that colostrum, the first milk, protecting the baby, and at the same time, the contact between the mother and the child means we don't need to wrap a baby in a lot of clothes. The mother's warmth is keeping the baby warm. And then some of these babies, the process of childbirth is quite strenuous for them. They use a lot of energy when they come out before they actually born and they start to feed. So that first hour of contact means the baby's blood sugar does not drop. So in the end, the baby does not get weak because the blood pressure dropped. They get energy straight away. So in every single way, that first hour of contact is essential, and usually you'll be told the golden hour after delivery, just because it facilitates all those processes for the mother as well as the child. So it's a natural process which allows facilitation. A lot of the times parents ask, so what if I have a cesarean section? Does that still apply to me? So currently we have now found out that when we do a cesarean section, it's to the mother's disadvantage for her to go under general anesthesia where she's completely put to sleep, versus where we can just within the spinal cord block the pain down lower for her so she's still awake. In that process, if the baby is born and we give the baby the child, it's actually the mother can still hold her child because she's not completely put to sleep. And that's the reason why almost worldwide the preference now is changed to what we call spinal anesthesia for the mother when delivering her baby rather than general anesthesia. Just because we don't want to lose that golden hour of breastfeeding, it's beneficial to mother as well as to the child. That's one of the things we do not want to lose. The other thing I'll come back to is why should a baby continue breastfeeding until 6 months of age? The 6 months of age that a child has are the most crucial for growth. Multiple infections during that period are very easy to pick up when you mix your different formulas. You're washing utensils with water. We may have forgotten to wash our hands well enough, so our hands have infections which the baby picks. At the same time, when the baby is getting that 6 months of exclusive breastfeeding, they are getting the right amount of nutrients at the right time. When they're hungry, they get enough. There's no limit to how much they take. So when they're breastfeeding, we are not controlling the quantity we're giving them. They're taking exactly how much they require for their growth, then go to sleep and wake up again when they're hungry, take some more. The other problems come in when we ask, so if my baby sleeps 6 to 8 hours without breastfeeding, does not wake up, is that good? Should I let my baby sleep? Should I wake my baby up to feed? Most babies, within the span of about 3 to 4 hours, they've digested almost all the breast milk that they've taken. So if a baby sleeps 6 to 8 hours, it might imply that the baby is not getting enough milk and may need to be woken up to breastfeed a little bit more frequently, such that the baby never runs out of breast milk and is always getting feeds frequently. The other thing is, as a mother, I would want to know, what should I feed so that I improve my flow of breast milk, I get more breast milk? There are a lot of myths out there and a lot of traditions different communities have. Are they all bad? Probably not. Do we have a consensus where this food specifically improves breast milk flow? Not really. There are a lot of theories out there. But the one thing a mother must do is take a full balanced diet herself. So which means she requires a lot of protein. She requires a lot of energy. So which means things rich in starch, the potatoes, the oats, the cereals. She needs a lot of that kind of energy for her to have enough breast milk. And the most important factor for breast milk flow is the comfort of the mother. If a mother is in pain, if a mother is stressed out for whatever psychological reason, automatically the amount of milk she produces is going to stop flowing. So which means she has to be comfortable when she's breastfeeding. So if she's breastfeeding, it's very difficult for her to get enough milk if she's busy running around doing a lot of things at the same time trying to breastfeed. She will not have enough milk. It's always good for her to take a baby feeds for 15-20 minutes. So it's good for her to sit down for those 15-20 minutes, sit in a nice comfortable seat, hold her baby, breastfeed her baby. The other thing we have kind of forgotten in terms of, we call it development, and we think it's embarrassing for a mother to feed in public places, and we don't let mothers feed. We always say, no, you can't feed here. This is against the ethics. We don't think it's ethical for you to feed. Please note that it's a mother's right to breastfeed any way she chooses. It's a baby's right to feed where the baby chooses. That's a worldwide guaranteed right by the World Health Organization. Please do not stop a baby from breastfeeding. The baby must be allowed to breastfeed. It's important for the mother, it's important for the child. We'll just take a short break here just so that we can come back and discuss now some of the problems associated with breastfeeding, how to overcome them. If a mother expresses her breast milk, what to do with that breast milk. We'll come back after the break and discuss those topics further. Welcome back to MTV and the program Health and Lifestyle. We've just come back from a short break and we'll continue our topic on breastfeeding. There's some other questions people often ask us is, I'm a working mother. I need to go back to work. My maternity leave ends after 2 or 3 months and my baby is very young. What do I do in such a case? And as the world progresses, a lot of mothers are now working and they have to find a way to store the breast milk and keep it so the child can still almost exclusively breastfeed until about 6 months of age. So we've been asked that if I express the milk and I store it, how can I store it such that it doesn't get bad? How long can I store that breast milk safely without that breast milk being contaminated or without me destroying the nutritional content of that breast milk so it becomes less useful? If breast milk is expressed and stored at room temperature, say for example in a glass bottle, then it's probably advisable that if it's at room temperature for the whole day, it's utilized during that day alone. If it stays over, preferably it should not be used the following day if kept at room temperature. If the breast milk is expressed and stored in the fridge, the normal fridge compartment of the fridge, not the icebox, you can safely keep that milk in the fridge for at least about 4 weeks before it actually goes bad. The only thing is when you remove that breast milk, let it warm up to room temperature if you don't have a warmer, and then feed the child. It will not have lost any of its nutritional content. If stored in the freezer and completely frozen, it may be kept for longer durations of time, maybe up to 8 weeks or longer. That is something that is still a bit under consideration, but we know that it can actually stay for about that long. When I'm looking at the breast milk and storage, there's something that very recently came up in some parts of the world, which is getting popular now as well in Kenya. That's now the breast milk banks. Those are now coming into the world quite aggressively because a lot of mothers are running out of milk and they want to use breast milk from the breast milk banks. That milk in the banks has been stored safely. It's been screened for a lot of diseases, so it is very safe to use. And it's usually given, we know that when given to mothers who don't have breast milk, it probably achieves almost the same effect as the mother's breast milk, maybe not as good, but it still provides the benefits of breastfeeding. There's other things that people ask us, that when the baby is breastfeeding and I run out of milk, what substitutes can I use such that my baby still grows and does not suffer any problems? There are a lot of different formulas on the market. different companies, different brands, all competing to tell you, I have this benefit versus the other company. The number one rule about all formulas is, one, they will never match breast milk. They will never be as good as breast milk. That's the one thing to keep in mind. After that, every other breast milk that's in the market, on average, is very similar. There'll be different brands. I am not at liberty to mention the specific brands just because I can't advertise for you. But what happens is they will all be labeled 1, 2, or 3. The 1, 2, or 3 generally signifies at what age group each of them can be used at. So the 1 is probably a baby from birth till about 6 months of age. Then 2 is usually from 6 months to 1 year of age, and 3 is above 1 year of age. Or they'll indicate for you 0 to 6 months, 6 to 12 months, 12 to 18 months on each of those formula. Then there will be the preterm formulas, which are unique. Those are for preterm babies. They're generally very different. The other thing that we might have is there are a lot of other products. They'll tell you this one is considered lactose free. This one is considered hypoallergenic. This one is considered anti-reflux. Each of those unique properties which are meant to be there may vary according to your child's preferences. So say, for example, your child is having a lot of diarrhea when you give one of the formulas. The thing is, most of the formulas have a bit of proteins from cow's milk. So your child may have a slight allergy to the cow milk proteins, which means you have the option of the hypoallergenic milk, you have the option of the lactose-free milk. Not 100% guaranteed that diarrhea will reduce, not 100% guaranteed that your baby will actually do better on those formulas. Those are some of the options you do have. When it comes to the anti-reflux or the anti-regurgitation formulas that are out there on the market, strictly speaking, we don't know whether they actually make a difference. Maybe they do, maybe they don't. Each of your children will be individual. You can try it on your child depending on the circumstances your child has. But the golden rule is none of them as good as breast milk. That's the one thing that parents please never forget. The other question we're sometimes asked is, if I cannot afford to buy the formula because they're not cheap, do I have other options for substituting? You probably do. If your child is now getting to about 4 or 5 months, you're running out of breast milk, the formula is proving to be very expensive, you may start early weaning if your child is losing weight. So if your child is losing weight, then you may introduce initially the safest thing to introduce are the starches and the carbohydrates. So things like potatoes, sweet potatoes, porridge is made out, the infant porridge is made out of rice and all that, may be introduced in small quantities. Preferably test one amount with one feed. If your child doesn't develop problems like diarrhea, doesn't end up getting a lot of like bloating, belching, constipation, you may then increase that. Now the danger of doing that sometimes is it's difficult to tell how much protein am I giving, how much of carbohydrates am I giving, and your child may lose a little bit of weight at that point in time. That's something you have to watch out for. It's not an easy process deciding what to wean. That's why a lot of hospitals nowadays have a guideline which they can give you and discuss with you based on local foods, based on local preferences, what's available, how to give it. Discuss with your nearest healthcare provider and they will guide you on what to do in case you have to start feeding early. Other problems parents face is somewhat mothers will ask you, my child cannot breastfeed. Why? Either because my child is not sucking well enough, or when I have the nipple, it's flat or it goes inside. So my child cannot hold and get the milk out. What do I do about that? There are two ways of overcoming that. One way is that there is a way that if you use the breast milk pumps, be it the manual or the electronic pumps, none of them are really better than the other. You can express some of that breast milk and get it out. If you express the breast milk and you fill up a container, that's one way of feeding your child. The question becomes, should I feed my child with a bottle? Should I feed my child with a cup? Should I feed my child with a syringe? Which of those three ways are the most beneficial to my child? The answer to that is neither one of them is superior to the other. It depends on what your child can take. Is your child accepting to take that specific method? Danger of using a syringe is there's a risk of pushing the syringe too fast, too hard, which means milk goes straight into the throat, chokes the child, and gives you problems. So then a bit of the cup feeding, small amounts with a spoon, or using a bottle become an easier option. The other question is, if some mothers will say, I just do not have enough milk. Before you give them the options of the breast milk substitutes, ask them, just make sure you examine the mother to find out if the nipple is not inverted. Again, decide, is it that mother doesn't have enough milk, or is it that the mother has not been taught how to put the baby on the breast such that the baby can take the right amount of milk? Very often it's just that a new mother may not have been taught how to put the baby on the breast, and that's the reason why she actually doesn't have enough breast milk, just because she doesn't know how to do it. There are other things that people ask us when my child is breastfeeding. Oh, my child cries a lot. My child has what we call colic. What do I do about it? The thing with colic is, what we know about colic currently is it's going to start on average when your child is turning 2 to 3 weeks after birth, would probably last about 3 to 4 hours every day, generally worse early morning and at night, and would last till about roughly 3 to 5 months of age. So it's probably going to last about that long in time. Children generally cry uncontrollably during that period. Once it settles, they go back to sleep, they go back to feeding normally. There are products on the market currently being sold where you're told this is anti-colic medication, use this medication, use this medication. The interesting thing about half those medications are, we really don't know whether they work. I mean, we prescribe them, we give them to you. Very often it's more about giving a parent a solution which we really don't know about. Are they safe or are they dangerous for your child? Probably safe, may not necessarily be dangerous when given to your child. But because we don't know what causes colic, and when we give you those medications to try and treat the colic, we are probably not making a difference, and either way, your child may still outgrow that phase and eventually just grow up as a normal child after the colic goes away. There's one last thing I'd like to mention before we end this session, and that's about belching your child. A lot of parents ask, how should I belch my child? How often? Do I do it 3 times, 4 times in between feeds? The answer to that is entirely dependent on your child. If your child belches 2 to 3 times and you get a lot of the gas out, that's okay. If your child belches 1 and is comfortable, not crying, leave your child alone after belching once. So that's a bit of entirely dependent on your child. So what we've looked at throughout this session is, what are the benefits of exclusive breastfeeding? When do you actually start breastfeeding after a child is born? What are some of the problems faced with children who have breastfeeding issues? And if we start substitutes at an early age, what are some of the fine details that we may look at when we're choosing a substitute, and what to look out for as far as the complications of the substitutes go? We'll continue this series and build up on different topics as we move along, and probably take each session as it comes. If you have questions, please don't forget to email us or send us the questions. We will try and answer your questions in some of the later sessions to come. Assalamu alaikum warahmatullahi wabarakatuh.